Good afternoon, everyone. It's a pleasure to be here. I'd like to begin with a question, a very important question, in fact. Who here has a favourite celebrity? I imagine a few of you have actually putting your hand up. I can't see you guys because I'm visually impaired. I forget that I'm blind sometimes. So I'd just like you to shout out a couple of names to me, if you don't mind. Favourite? Anyone?
Come on, we must have some favourites.
Cristiano Ronaldo.
No,
George Clooney.
Clooney. Oh, I like that.
Ian Wright.
We have quite a few. Okay. Okay, great. So I'd just like you to imagine you've had a really, really long day at work. You're tired, your feet are aching, and there's still an hour left to go before it's home time. You're walking down the corridor to see your final patient of the day, and you're met with an unexpected surprise. You open the door to room number 3, and who does it happen to be? Mr. George Clooney. Now, what are the chances of that, you wonder? Tending to Mr. George Clooney, 1 in every 7.6 billion, which, by the way, just happens to be the current world's population, according to a new study. Now, would you give Mr. George Clooney the same high level of care and attention you would give a 17-year-old fighting for her life? Would you go above and beyond? Would you pull out all the stops to let her know that she's being cared for and looked after? Just have a think about that for a moment, because we'll be returning to that later on. Now let's go back to when you were about to see your final patient of the day. You open the door to see a 17-year-old teenager who just suffered from a life-threatening allergic reaction to penicillin. Your patient is wrapped in bandages like a burns victim. 60% of her skin is damaged and scarred from skin lesions. She's unable to open her eyes, to move or even speak, numb by the cocktail of intravenous medication. She's scared out of her mind, has no idea whether she's going to live or die. What would you be thinking in that moment as a doctor? She has no idea that within 12 months she'd lose her eyesight, be left with a chronic respiratory condition, and have surgery to remove part of her lung. Could you imagine if that was you, or maybe someone you knew, or perhaps a loved one, to just have your young life pulled from beneath you within a matter of hours? What would your attitude be? Would you see your circumstance as unfortunate, or feel grateful to still be alive? Could you put yourself in your patient's shoes in that moment? 15 years ago, that patient was me. I was diagnosed with an extremely rare condition known as toxic epidermal necrosis, or a severe form of Stevens-Johnson syndrome, which only affects 1 in every 3 million people. Now, you may be looking at me today and thinking, I look perfectly fine. I look healthy and well. What's the secret? Did I receive some kind of celebrity treatment while I was in hospital? Well, let me tell you that it's not been an easy journey. I've had to overcome many health challenges, physically, mentally, and emotionally. I've undergone many procedures and had several hospital admissions, and received some pleasant and some not so pleasant times as a patient. On some occasions, I felt like I was just treated like a number and not as a human being. On other occasions, I've received the most outstanding care, where staff have gone above and beyond to make me feel cared for. In fact, you could say I felt a little bit like George Clooney or a celebrity when I've been in hospital. So today I want to share with you 3 key C's which have played a fundamental role in my healthcare, recovery and outcome as a patient, and which I hope will be of use to you when you work with your patients also. So key C number 1 is continuity. Why is continuity of care important? When I think of continuity of care, it's a little bit like seeing your favourite hairdresser. Now that sounds a little bit strange, but stick with me here, I'm just about to explain. Why is it that we see the same hairdresser every time? It's because we build a good relationship or rapport. They understand how you like to have your hair cut, and most importantly, you build trust. I believe the same applies to healthcare. But what happens when there is a disconnect of care and a lack of continuity? When I think back to when I was first diagnosed in 2002, the healthcare I received was very different. I was seen by many different teams, many different doctors. Now, what effect did that have on me as a patient? As a young teenager, being away from home and being quite sick and unwell, I wasn't informed about what was actually happening. In fact, I wasn't even told what my diagnosis was. I remember a moment when a nurse came into my room and said, "Miss Mystery, it's time to do some swabs for MRSA." And I thought, is that what I have? Is this what's triggered in my life-threatening reaction to penicillin, MRSA? So I started to research it and read about it, and it didn't make any sense to me. So that's when I began to ask my doctors questions. What had actually happened to me? That's when they told me, you had Stevens-Johnson syndrome. Now, a lot of stress could have been saved if I'd just simply been informed about what had happened to me. Surely that's a doctor's duty to let the patient know, I thought. I was a newly diagnosed patient and wasn't really sure how to ask questions or interact with doctors, so I feel like if I was told, it would have made a huge difference to my healing and recovery and reduced a lot of stress for me. On the flip side, when I was transferred to the Leicester Glenfield Hospital, the care I received was very different. There was a continuity of care. I was seen by the same team of physicians and physiotherapists. And this was very important to me as a patient because over time we were able to develop that foundation of trust and understanding and a good relationship as well. And this was of benefit to me because finally I was able to open up about how I felt, about my health condition and feelings as a patient. It increased the communication between us as well. And the trust that we developed enabled me to open up a bit more about why I wasn't taking certain medications. And just to be honest about it, really, I felt like I was in a bit of a safe environment. And seeing the same faces every time just made me feel like I didn't have to explain my medical history like a broken record. Felt like I was being listened to. Which takes me on to my second point. Some of you here may be familiar with a GP called Dr. Iona Heath. For those of you who aren't, she's a well-respected GP of over 35 years, is a writer and was the former president of the RCGP. The following quote relates to my second point, and she says, quote, "I've been struck by one powerful tool in my medical repertoire, which is far more effective than any intervention I've ever come across." I'll need some audience participation. Can anyone guess what that might be, what she might be referring to? So, yeah, well, it doesn't begin with a C either. Well done. Caring to listen is point number 2. And caring to listen is quite a significant point actually, because as a patient, you know your body and your symptoms better than anyone. I know over the last 15 years, I've become so in tune with my symptoms that when anything feels a little bit off, I know exactly what I need to do, inform my doctors and increase my treatment. But what if you're in a situation where you're not actually being listened to? Even though you're crying out in pain, you're distressed, but still nobody hears you. I remember going into theatre once for a treatment, and it was the most horrific experience of my life. It still plays over in my mind sometimes when I think about it. And do you want to know what the worst part actually was? it wasn't the camera being pushed down my windpipe, it was actually the unempathetic approach from the staff who was supposed to be taking care of me. I remember being in theatre, I'd been nil by mouth all day, I was dehydrated, I was surrounded by a team of doctors trying to insert an intravenous line and were failing every time because I was just so dehydrated. It was a scary experience. I didn't know what was happening. I just wanted to get out of there, but I felt trapped. Now, what could have been done differently to make my experience much better, you could say? Just listening to the patient simply, and just offering some empathy and care and letting them know they're going to be absolutely fine and that they're actually in safe hands. That would have made all the difference in that situation. And I'm sure many of the patients have been in that situation too, and it's not something I would wish upon anyone. So listening is definitely key. This brings me on to my third point, which is collaborate. Now, there's a secret about me which I don't tell very many people, but I like everyone in this room and I'm happy to share because I feel like it will be important for you when you're working with your patients. I'm here with my guide dog Laura today, and it's easy to assume that the biggest challenge for me to overcome was my sight loss. But actually it was something less obvious. When I was told that I was going to lose my eyesight, honestly, it only took me 30 minutes to acknowledge and accept and move on. My lung condition has taken me almost 15 years. And that's a pretty long time. The collaborative approach that I've received from my medical team has made a massive difference to me. It emphasises my first and second point, the caring to listen and the continuity of care. The team that I've been seen by has helped to develop a lot of trust, understanding and empathy. And I felt like I was at the centre of decision making, and partnering with patients can be quite powerful. I felt quite empowered and able to listen to my medical team about what I needed to do to take better care of myself. And I hadn't actually experienced that a couple of years prior to that. I found that it's really important, particularly when we were in difficult situations. I recall a time back in 2014, actually, I had a really long hospital admission for about 8 weeks with a collapsed lung. I'd been in hospital with a collapsed lung previously, but for some reason it was a little bit of a longer admission. And by the end of that admission, my respiratory consultant and my physio came into my room and had to deliver some news to me. And I could have taken it one of two ways, in a negative way or a positive way. But the thing that made the difference was the way in which the news was delivered to me. I was basically told that my lung may not fully recover, but the empathetic approach from both people made such a difference to me. It uplifted me and enabled me to believe that I could get better, that I could work with what I had, to focus on what I could do, as opposed to what I couldn't do. All three approaches, the continuity of care, listening to your patient, and the collaborative approach, has made a massive difference to my patient outcome. I feel more empowered as a patient now to manage my own healthcare. I've transformed my health. There's less dependency on medication now. I can't remember the last time I was actually an inpatient. It's been that long. And my blood pressure's back to normal now too, through physical activity. So I would say really have a think about these three key points. And whether it's a 17-year-old teenager that you're seeing, or 85-year-old Mr. Smith, or even if it is Mr. George Clooney, treat every patient as a person, as an individual, as if they were a superstar. Thank you.
Thank you.
Happy to take questions.
Question.